Hey there, are you looking for help on how to start solving your SI joint problem? In today's video, I'm going to walk you through 3 exercises that you can start doing right now at home without any equipment to start fixing your SI joint problem. In case you missed it, I have 2 other videos here on our channel talking about what exactly the SI joint is, what it does, and how problems present for people that are having issues with their SI joint. The second video talks about how you can test yourself at home to see if it is an SI joint problem that you're dealing with. You can find these videos in the links below in the description. And for those of you that don't know me, I'm Dr. Sam. I'm a specialist physical therapist over here at Paso Manual Physical Therapy. And I've been helping out patients in the clinic with SI joint problems for years. And I'm looking forward to helping you with these exercises today. Okay, so let's get into the exercises. The first one that I'm going to show you is a bridge. Many of you may have done a bridge or a variation of a bridge before, but we do it a little differently here. So let's go ahead and get into how you should do that. You can lay down on your bed, on the floor, on a yoga mat, whatever you feel comfortable with. You do not have to be on the floor though. So the first part to the bridge is going to be flattening out your back into the table. So you can see if I'm just laying here, there's a little bit of an arch in my back. You see my stomach kind of come forward. Whenever I flatten it, I've activated my abs and I'm pushing my tailbone into the table, okay? And then from this position, I'm going to squeeze my glutes and lift. And then hold it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then you come down without arching your back, okay? So you saw how I was here, and then I came down, and then I am back in this position where my stomach's a little bit forward. Now I want to mention 2 things about this. First of all, you do not have to come up as high as I did for that lift, okay? So you can flatten out that stomach, squeeze your glutes, and you could hold here. This might be a good starting point for you. Do that 10-second hold and you're just squeezing your glutes and pushing that tailbone down into the table. Or you might do better if you, again, flatten out that stomach, squeeze your glutes, and just lift a little bit, maybe an inch, okay? As long as you feel your glutes working, you don't feel your thighs working, you don't feel your hamstrings working, then you're doing the exercise right. Now, one other tip that you can use with this is that you can let your knees come a little bit out to the side, almost drive them out to the side. Don't let them fall all the way, but you don't want to be here either, okay? Flatten out the back, squeeze the glutes, and as you come up, you saw how my knees went a little bit to the side. That's going to turn your glutes on a bit more, okay? So those are a couple variations and a couple tips that are help you be more successful with this exercise. Now, the second exercise is an ab curl, okay? It's similar to the bridge in the beginning. So again, you got to flatten out that back, pushing that tailbone into the table, okay? This is huge for both of them, okay? You've got to keep this position, and then you're going to bring your chin to your chest, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then come back down. So you have to keep your back flat, pushing your tailbone down as hard as you can to the table the whole time. The chin tucked to your chest is important for supporting your neck. And you probably noticed as I lifted up, I was looking through my knees here, okay? I don't want you here, neck way up here. That's not gonna be good for your neck. It's not bad, but it's just not good for them, okay? Now, the other variation for this is just a hold, similar to how we did with the bridge. So you can flatten out your stomach, pushing that tailbone down, and then you just hold here, 10, 9, 8, 7. And halfway through, I always tell patients, push, 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 5, 4, 3, 2, 1. Okay? And so that is a variation of the ab curl. If you can't quite do this for the full 10 seconds, and even if you can only come here, it's okay. You can go up as far as you need to or not so far. As long as you're activating here and you're feeling this from the belly button down, you're doing the exercise right. So the third exercise, you're going to roll onto your side, okay? This is called a clam. And if anybody has done physical therapy before, a lot of times you're doing these, but again, we do them just a little bit differently here, okay? You're gonna be on your side, knees bent however you're comfortable. You don't have to be way up here or way down here, just a comfortable position, okay? You're gonna roll a bit on your side here. So you saw how my top hip came forward, okay? Which also brings my top knee forward. Ankles are gonna stay together and you're gonna lift. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now, a couple things here. Whenever you come forward, sometimes patients are almost like this to get the activation in the muscle that we want, okay? That's okay. It's not a problem. What we want you to do is to feel this right here on your back pocket, okay? It's a deep glute muscle exercise. Don't want you feeling it here in the thigh or here down the side of the thigh. If you're doing that, then you're using the wrong muscles to get the motion. So we want to be a little bit forward, lift, and hold. And the second thing with this, you don't want to come too high because you saw how my hip rolled. Okay, then I'm using other muscles. It does not matter how high you come, as long as you are feeling it right back here. Okay, so that's the clam exercise. So we went through bridges, ab curls, and clams. These exercises are foundational in helping you start to fix an SI joint problem. I give these exercises to almost every patient that comes in the clinic because they almost all have weak glutes and weak abs. So these are a great starting point to get you fixing the muscular imbalances that often cause the SI joint problem in the first place. Now, I want to remind you that fixing an SI joint problem can take a while. It can take a few months or even a year, but these are the exercises to start getting you on the road to fixing it, okay? Now, if you've started doing these exercises and you feel like they're helping you and you're starting to feel a bit better, then there's a good chance that our online program is for you. So if you're interested in that, you can click the link below in the description and find out all about that. I look forward to seeing y'all soon. Take care.